Okay, let's get the recording going for those that can't make it this morning. Happy AEP, everybody. We are almost a week into AEP already. Can you believe it? Lots been going on this week. I'm pleased to have on the line with me Judy Daniels from Berwick Insurance Group. She'll be doing her Judy's Corner today and just talking through some of the things that she's seen over the first week and covering some of those topics as well. We're going to try and keep this to around 30 minutes today. I know I've said that for the last few weeks, but we want to keep this to a positive amount of time, give you guys some time back into your day. And without further ado, let's get started. If you're new to this or you've not been on our call, welcome. And thank you for spending your early Friday morning with us. We're here every Friday, normally at 9 a.m. for AEP. We are here for the next 6 or 7 weeks at 8 a.m. Okay, let's get started with some updates. As I mentioned, we're now within the first week. So, one of the things that I love in AEP is hearing some of the good news stories that we're getting across the state, across the country, really. We got agents all over, and I love hearing that good news. So if you've had a success at a meeting, I heard yesterday somebody had a meeting, they did 4 enrollments out of 4 people at the meeting, which was fantastic. So things like that I want to hear, guys. Please send, text, email, however you want to do it. Send me a voicemail. It's all good. We'd love to hear your good news stories. If you're struggling, you're not sure what's happening, it's been quieter, you've not got those enrollments you thought, again, reach out, share some ideas, bounce some ideas off me. That's what I'm here for. My team's here for as well. And I know Judy does a lot of that with a number of you and all of her agents throughout California that she has. And of course, into Nevada and other states for AMA as well. What I have been seeing is a lot of activity, a lot of things going on. I know a lot of you at camps. Walmart has started. And, I would love to hear how that's going for many of you. I've spoken to a few of you on that program there, and, want to make sure that, we're supporting you. You've got everything you need. And if you need stuff, reach out as well. Okay, you've probably been seeing the costs for Medicare are going up. You've seen a lot of this this year as well. Part B is going up by more than $10 to over $174. You've seen PDP premiums increase. Obviously, we have an outlier with the WellCare plan, but essentially all PDP plans are going up between 30 and 150%. We got plans over $200 now. It's crazy that somebody's PDP plan could be more expensive than their Medicare supplement plan or Medigap plan. So this is a great time to discuss with some of these people who may not be able to afford these plans now. And by the way, this is not going to stay, this is not a 1-year thing. I'm telling you, all of those PDP plans will be increasing next year, even more so. The way that drug plans are going to be across the board is going to be different next year. So as in, next year's plans. So 2025, we're talking here. So there's already folks that are struggling to afford. They've got fixed incomes, they've left work, they've retired, whatever, and they're using their retirement fund to pay for their cost of living. So with all of these going up, it might be an idea. It might be a time for somebody to go onto a PPO plan. There's a lot of great PPO plans out there. In the marketplace, we've got some great networks as well. And one of the key things to remember is whatever PPO plan you're going to put the person on, if they go out of network, then essentially their maximum out of pocket goes to the out of network out of pocket. And I got asked this question this week where somebody has been using in-network doctors. They went out of network and they believe they used they used all of their maximum out of pocket. The thing is that goes then to the out of network move as well. So it's really important to kind of understand each of your clients, what their challenges are, and present. And this is the key thing: is present that plan, present the best plan that's going to help them. That's the key part of this as well. It's going to save them money. And don't forget, you've got the trial period as well. 48-hour scope of appointment. Again, we mentioned this last week. If you work a kiosk or informal sales event, that's a walk-in. So anybody coming up to those informal sales events, it's not an appointment, it's a walk-in. So you can fill out the scope and you do not have to abide by the 48-hour rule. So, again, if you're taking that virtual telephone call, that's a walk-in as well if somebody calls you and you are not expecting their call. So, again, you can obviously focus on those type of events. And if you're booking slots or you're booking appointments, then you do have to give that 48 hours. So a lot of people are using the informal, the walk-ins as a way to get around that. Okay, those are some of the three key points. I wanted to talk about Medicare Advantage and Part D star ratings. They came out over the last few days. So I've got the CMS document on here, which kind of goes through a few things. And then I've got a summary at the end of what I'm seeing in California, Nevada, but also a couple of other states that I know we have agents in, including Florida and Texas as well. So this is an overview, so it's not by county or plan specific. So just want to let you know. So Medicare star ratings came out. I know that's pretty small there for you to read, but this is the CMS document that was published. And it talks about the highlights and the changes in the methodology as well. So again, this is covered both with Medicare Advantage, with prescription drugs contracts, and there's 40 quality and performance measures, 40. So they're judged on a lot of things, and you've seen a lot of changes this year as well. Okay, so as I said, there's 40 unique quality and performance measures. MA only is rated on 30, and PDP contracts are rated on 12 measures. So that's how this is measured. As finalized in previous rulemaking, again, there were some realigned measures as well. And, each year the star rating is just being realigned to make sure, A, it's fair, but B, it's also keeping these insurance companies to task, and it's making sure that it's protecting seniors. And that's really what the star rating is meant to do as well. And of course, this document is available. We'll post it on our portal as a link, but it is available on the CMS website as well. So 42% of MAPDs earn 4 stars or higher for 2024. So I'm not sure whether you guys think that's low or high, but for sure there's been some changes this year. So only less than half of all MAPD plans are actually 4 stars or higher. So that tells you how difficult it is as well. And then weighted by enrollment, 74% of MAPD enrollees are currently in contracts that have 4 or more stars. So that's a really interesting point there. So 3/4 of your clients are in plans of 4 stars or higher. 27% of PDPs receive 4 or more stars, so even lower on prescription drug plans. So it just goes to show it is more difficult. And again, only 2% of enrollees that are currently enrolled will have a plan that has 4 or more stars. So that's a lot lower than MA and MAPD. So this is just a table to show you kind of the percentage of plans on each star rating across from 2021 to 2024. And if you notice on here, there's no real consistency. As you can see here in 2021 was kind of the lowest for 4.5 stars or 4 stars and above. And then in 2022, that's the year when every plan seemed to be at 4 or 4.5 stars. Now we kind of come to some equilibrium. And again, we're back down to a fairly low amount. But one thing to be sure is there's more plans that have 5 stars now. So, that's quite a good point to look at there as well. Okay, let's move on. And I know some of you are like, Neil, why are you telling us this? I think it's important to note the carriers you represent and really what their star ratings are as well. And again, this is the same table here for Part D plans as well. And as you can see, the average rating this year is the lowest it's ever been for prescription drug plans. Okay, so some highlights. 31 contracts are highlighted on Medicare Plan Finder performing with 5 stars. 31 are MAPD, 3 are 1876 cost plans, and then 2 are only prescription drugs as well. For 2024, 11 contracts receiving 5 stars didn't receive it last year. So there's 11 new contracts this year as well. There are also 6 contracts identified with a low performing icon, consistently low rating. So if you are at a low rating for 3 years or more, and that's 3 stars or less, you are then listed with a low performing icon, and you cannot actually enroll directly on Medicare.gov. I'm not sure if you knew that, but if you are actually listed as a low rated performing plan, and some of our plans are on here, just to let you know here as well. So if you look under here, Silver Summit Health Plan, that is WellCare in Clark County, and they're listed on Medicare.gov as having a low performing, consistently low performing rating. And nobody can actually do an enrollment directly through Medicare.gov. So, you know, that's an important note to have here for those folks out there in Las Vegas. Organizations that are non-profit more frequently earn higher ratings than organizations that are for-profit. Kind of makes sense in a way, because the non-profits are putting their money, or what I think is their money, back into the plan. And essentially, for-profits have to take care of their shareholders. That's their job. They've got to take care of their shareholders and make sure that bottom line is protected as well. Okay, and again, this is just a distribution of overall star ratings. And again, this is throughout the country, so I don't need to get hung up on this, but I want you to sort of see where this is going. And as you can see here, generally overall star ratings associated with contracts that have more experience. So the longer they've been in the plan or been doing this, for example, 10 years or more, generally you get the higher star rating as well. More tables here as well. So again, that's showing less than 6 years or less than 5 years. So have a little look at that. This will be available, as I say, it already is on CMS website, but also we'll get this link up on our portal, I think, as well. Okay. And of course, this just kind of goes through what we've been talking about. Okay, so here's our highlights and lowlights. So I mentioned both. So I think the key thing here that I'm hoping everybody is aware of, Kaiser went down from 5 stars to 4 stars. So they are no longer a 5-star plan. So that's been pretty significant. They've been at 5 stars for many years. Also, you notice as well, Scan Health Plan, who was also a high performing plan, they have gone to 3.5 stars in California. And I know some of you know this already, have seen this. And please note at the bottom, there may be plan or regional differences. So please don't text me saying, Neil, I am up in X county and one of these plans is 3.5 and one is 4.5. Absolutely. By plan, it can change. But I'm just giving you an overview here. Alignments stay consistent. They're at 4-star. Humana as well. Probably the most consistent across the board. They're at 4-star. Aetna 4-star. Blue Shield of California 3.5. United Healthcare 3.5 star. So all of these, if you think about what we were talking about earlier, anything above a 3.5 star is really a good performing plan. Anthem at 3, WellCare at 3, and then Brand New Day has gone to a 2.5 star, and Molina has gone to a 2.5 star. Ironically, who are going to be buying Brand New Day, we believe, or buying that plan out next year. So those are the 2 plans at the lower performing plans as well. As I mentioned, there may be regional differences between San Diego and Sacramento, Sonoma County and LA County. Yes, I get it, but this is the overview. So the best way to find out your star ratings, go onto Medicare.gov. It has them all up there now. So let's look at Nevada. Select Health has remained their 5-star plan for next year. So that plan can be offered to clients year round. Alignment has a 4.5 star plan now. but their platinum plan is 3.5 star. And I thought it was important to put that. Obviously, being throughout Nevada is a little easier. There's less plans. United Healthcare is a 4.5 star plan in Clark County this year. That's an increase. Humana has remained a 4.5 star plan as well in Clark County. Just to let you know, United's PPO is though 3.5 star, and wanted to mention that Humana, their top 3 plans, which is 056, 028, and 082, those plans are 4 stars. So there are changes by plan. Aetna's a 4 star, Scan is a 3 star plan, Anthem 3 star, WellCare is 3 star. And as I mentioned, they are 3-year Medicare warning. Nobody can enroll in WellCare on Medicare.gov. So that gives you the Nevada overview. Now a little bit in Florida. I know some of you folks are out there selling, but also residing in Florida. Devoted is a 5-star plan in Florida in certain counties. Humana is a 5-star. Simply Health is a 5-star, and United Healthcare. So look at all those 5-star plans in Florida. Pretty unbelievable. That's going to give the Floridians out there a huge opportunity to make changes throughout 2024. Texas as well. Wanted to not leave out those of you that are out there in Texas. In Dallas, United and Humana is a 4.5 star. There's no 5 stars. In Houston, Erickson Health Plan and Kelsey Care is 5-star plans, the only 2 5-star plans. Devoted, again, is highly rated, 4.5 star, as is United Healthcare. So they're the top performing plans in Texas. Well, wanting to go through the star ratings, you are going to get asked those questions. And don't forget, you have to compliantly talk about star ratings in a presentation, right? Hopefully you all know that. You have to mention that. Don't forget the books that you might have pre-ordered probably don't have the up-to-date star ratings in. You may need to get those star ratings from the carrier, or they'll get sent to you, or you can order the inserts as well. But you must, of course, tell your clients about the star ratings. Okay, so let's have a little look here. Some questions here, and I'm going to get Judy to talk about a couple of these here as well. Couple of you asking about the trial period for Medicare Supplement. So you have a one-time lifetime, yes, one-time lifetime trial period with a Medicare or Medigap plan, where you can try a Medicare Advantage plan for up to 12 months and then go back onto your supplemental plan with no underwriting. That's the key part of this. So if you're on a supplemental plan, or your client is, and it's costing them $300 a month, and their drug plan's going up, you could try them. They could try a PPO Medicare Advantage plan for up to a year. Only up to a year, and it's a once in a lifetime. So if they've ever been on a Medicare Advantage plan, that trial period is not relevant. It's only if they've never been on a Medicare Advantage plan. So a couple of your questions on that. Hopefully that answered it. It's a great way to get people to try a plan. One thing I would say, though, is if you're going to put somebody onto a PPO or an MAPD plan for a trial period, make sure they don't just go try it for 2 months. 2 things will happen. They're not really going to see if that plan works for them. And secondly, you're going to get a chargeback. Yep, you're going to pay everything back for your commissions for that client. So please, what I encourage is, look, try it for a year, see how you get on. That way you don't get a chargeback. It's a way to get a client as well, to get new clients if somebody is on a supplement plan. But again, you want them to try that for as long as possible. Other questions here. Do your existing clients need scope of appointments? Well, if you're going to talk benefits, yes, simple as that. A scope of appointment is if you're going to talk benefits. However, they last a year. So if you filled one out less than a year ago for your client, it will be relevant to use today. Okay. Not really questions, just some comments coming in as well here. Just want to make sure comments go in the chat, questions go in the Q&A. So thank you so much for that. How do we answer the question about a low star plan? Do we have to, as we have to mention the star rating? Well, don't forget, you have to mention this year's star rating. So essentially what you need to do as an agent to be compliant is say that this plan, and I think you're talking about WellCare, is currently a 3-star plan for 2024. That's what you need to do. You don't need to tell them necessarily that they've had a low star rating and they're flagged by Medicare.gov, you've got to present those benefits and tell them the current year's star rating. Okay. What would you say are the factors that United Healthcare, for example, the star ratings may have it decreased this year? I think essentially it's just got more difficult. I think, if you look at all the rule changes from CMS, and I'm sure Judy will kind of may have a thought on this as well, but, the metrics are changing every year. And I think what's happening is this is more difficult to get a higher star rating. You're seeing that now. For the last few years, it's been probably the easiest. Now it's not. So, I think that's a key point here. Okay, so Judy, I'm going to pass on to you now for Judy's Corner. Thank you so much for joining us today.
Hey, you're very, very welcome. So, I want to talk about retention, and I know we want to try to keep this real quick this morning. But it's important to contact your clients, especially those that are in plans that are terminating, leaving a county, perhaps plans that are dissolving a contract that they have with a medical group, or plans that are changing names or plan numbers, like WellCare is right now. And I'll talk more in depth about WellCare in just a moment. But I'll give you an example. I live in Ventura County. I've had a number of clients on Blue Shield of California, my own personal clients. Don't have as many as you guys do, but I keep my hand in things. And so I reached out and contacted my Blue Shield of California clients to let them know that their plan was terminating as of December 31st and we needed to get together. Sent out the scopes of appointments and so on. Well, I can tell you that I met with one of those appointments last night. She had invited two friends to join us. Now, if somebody magically appears to an appointment, you just have to get a scope of appointment signed at that point. I ended up leaving there a lot later than I had planned, but I left with three applications. So bear in mind when you're calling folks about these types of changes and setting appointments with them, encourage them to invite friends or family that also need Medicare information so that you can also talk with them. Now, maybe you want to make it after you meet with that particular person, schedule them to come in a half hour or an hour later, but so that she can have her or his privacy when you're talking about their plan. But you're certainly able to assist other people that may show up at that appointment. So I encourage you to contact all of your clients, but at the very minimal, you should be contacting those who are having changes in their plans. Speaking of WellCare, there was a communication that went out. Neil, I don't know if you were going to cover this or not, but there was a communication that went out from WellCare stating that they were changing plan numbers for some of their plans to consolidate. As you know, when they acquired HealthNet, Centene had a multitude of plans out there in every state that they were in, and they're now consolidating a lot of those plans. Well, that means a plan number change, right? It's still a plan change. That plan's terminating, and then there's this new plan, and they're automatically migrating your clients to that new plan. So the agent of record is staying the same. Their primary care physicians are staying the same. Basically, you don't have to do anything, and neither does your client. They're getting a new card in the mail. They're getting a letter about the termination of their previous plan, and of course, a letter about the new plan. Unfortunately, Medicare evidently sent out some emails or some communication to people. Keep in mind that Haiti Castellano with WellCare is investigating this. But if there's any time that it was so important to reach out to folks, now is the time. And that means if you've got people on WellCare, I don't care what county you're in, what county they live in, what plan they have, please reach out to them. Let them know if they receive any communication to give you a call, that there are some changes. They don't need to do anything. They don't need to physically change their plan or do any paperwork or anything like that. Just let them know that you're here for them. If they have any questions, please reach out to you. But most of all, you should be reaching out to them. That's so very important. And I've talked to a lot of agents out there right now who are saying, you know, Judy, some of my meetings aren't being as well attended as I thought they would be. You know, what do you think your take is on this? I'll simply say that we have a lot going on in the world right now. I understand that in some communities, they're very upset about the Middle East. I understand that there's even people who are still kind of scared about coming out to an in person meeting because they're afraid of COVID or getting the flu. You're always going to have those folks. So don't give up, though. Stick with those kiosks, stick with those sales meetings, whatever activity it is that you're doing. Some seniors just want to have a little bit of a break to really look at things. I'm finding that a lot of people are bringing their new Medicare and U booklets to some of these kiosks and some of these sales meetings. And I've also heard from a lot of people that they've been in the same plan for 2 or 3 years because of COVID and everything, and they felt that they should really see what was available out there this year. So you will find eventually that you're going to get more and more folks coming to the kiosks that you're working and the sales meetings that you're doing and any other events that you're doing. They will be there. So don't give up, stick with it, and they'll come. And Neil, that's Judy's Corners for today.
Thanks, Judy. Really appreciate it. Thank you so much, particularly that information about folks not necessarily wanting to come out or meetings being attended. Don't forget, if you're doing a meeting, even if it's on behalf of a carrier that is supposedly marketing, you're not in control of that marketing. You're not in control of what they're doing. So you, as an agent, as an independent agent, a business owner, entrepreneur, whatever you want to call that title, or the hat you're wearing, should be looking at your own marketing as well. So that's important. If you do not have flyers marketing where you are, you're missing out for sure. So think about that. Think about where you can get a marketing piece that's going to tell people where you are. Because if you don't, you're a secret. Simple as that. You might be in a room somewhere waiting for people to walk in. Well, if you are not doing your bit to reach out, then essentially, you are going to miss out. And that's really important to know as well. Judy, I have one question on here. Is there still an SEP for United Healthcare for a November 1st start date? I think this is for LA County.
There is.
Okay, there we go. That answers that question. So, of course, that still gives you the opportunity to do 2023 enrollments. Just a note on that, we're all judged on numbers. That's what this game's about. And it's funny, you get to this time of year, nobody cares about 2023 numbers anymore. It's all about AEP. It's all about January the 1st numbers. Really interesting how that works in our industry. Okay, let's run through these updates and we'll get you out of here in the next 5 minutes, I'm pretty sure. Medicare, so Aetna Medicare Solutions, lots of pickup points, as you can see there in Nevada over the next week or so. As you can see, SG bar, not sure where that is. So 3 to 5, that looks like a happy hour opportunity there as well. Pick up some kits. You got CenterWell in the mornings over lunch as well. Grab a coffee, get some kits from Aetna. Got some great plans out there in Nevada. CenterWell, don't forget, you can get paid. Yes, you can get paid for placing a client with CenterWell Primary Care Medical Group. It's pretty awesome, but you have to make sure you have this link and you watch the video and you attest to, to this program. And basically you have to get the scheduling fee, you've got to go through the compliance. So that is, if you haven't done that, please do. Again, CenterWell just listing all of the plans that they are offering as well, which is pretty good. So original Medicare, obviously in supplements, and then the MA plans from all of those carriers listed. And just on here, you do not earn a scheduling fee if you have not completed training and attestation. You call the front desk and schedule the appointment, or if your client is not on MAPD. So if your client calls, you don't get it as well. So you have to use the scheduling tool or the scheduling phone number to get that appointment fee, just to let you know. P3, again, P3, lots of tools to help you. P3 is a good partner, a good medical group out there in Nevada. So again, lots of opportunities, including the broker appointment program as well. Upcoming events, they got their new Nellis clinic opening, and they got an open house on November 8th. Early morning, folks. If you want to grab a coffee and go over there, please do. WellCare, as we mentioned, they have a lot of opportunity. If you're in Nevada and you are struggling at the moment for activity, or you're struggling for enrollments, get on these calls. This is a chance to get leads. WellCare does, although they're a 3-star rated plan, they have some fantastic products this year. They've got their new Spendables card. They have a great C-SNP and a fantastic dual plan as well. Their MA plan is very competitive. Their dental, they've got $4,000 worth of dental. Is worth going on here, and this is an opportunity to talk leads, get leads, and sell this plan. California updates. Blue Shield of California, just want to let you know they do have their bonus program, particularly for those folks that are experiencing disruption, where you may have clients going on to MedSup. Molina enrollment guides are now posted in the marketing store, so you can order them. That's good news. Better late than never. And they're continuing their training just to get you guys more familiar with Molina. They've got some training next week on, I think that's Monday morning at 10 a.m. And it's a workshop that covers the products, the tools, and everything to do with Medicare. Again, kiosk space at Rouse. If you are not out there and you want to do a kiosk, there is kiosk opportunity. As we mentioned, please reach out to Lisa if you're interested, Lisa Perry, and she can get you the list where it's available, and you can represent Molina. Particularly, I would consider this if you live or work in an area that is basically underserved, or an area for lower income folks. Scan as well, their Scan Compass plan, which was going to be with Optum. They are not using Optum anymore, so watch out for this. I haven't heard that they've officially come out with who they're working with, the Compass plan, so just bear with them on that. But they have the lowest MOOP in the market. Don't forget, they have a great plan to offer out there as well. United Healthcare, important information, Scripps hospitals will be in network on their PPO plan. That's important. A lot of folks like to go and see Scripps network. This is the hospital, not the medical group. So please note, you know, any doctors that are affiliated with a Scripps hospital, and somebody wants to get any type of surgery, then please, that is a great way for them to stay on a Medicare Advantage plan with United Healthcare PPO. And of course, this just goes through different providers that they are accepting as well. This came out last week. You might have seen this if you live in San Diego. Important news around the Scripps disruption. Wellbe Health, Saturday, 4th of November, have an open house, and they're going to celebrate their brand new facility. And now you can talk about their PACE program. Don't forget, PACE was always not allowed to be sold by agents. Now through Wellbe, you can offer PACE. Lots of WellCare training coming up as well in California. So again, just wanted to put these up here. Lots of good stuff. In fact, Eric is a great presenter, very good trainer. So that power selling during AP is worth going on, particularly, again, as I said, if you're struggling, they're offering some really good stuff. Other updates, Producer World, lots of information on there for Aetna. And again, don't forget, all the 2024 benefits and plans are on there. Just wanted to remind you guys on this as well. And again, if you need to know your status, there's an enrollment tracker, that type of thing, agent management for commissions. So lots of good stuff for Aetna there as well. They also have the Pace Setter program as well. And that's the newsletter where they're leading agents, you know, again, like a little bit like some of the other programs that are out there. This is for folks that sell a lot of Aetna. You can get different tools, marketing dollars, that type of stuff. I know Humana does a similar thing as well. HRAs are back at alignment. I think we saw this last week. Exciting to see that most carriers now are offering reimbursement for HRAs or VBEs, value-based, VBEs. Value-based enrollment, sorry. So yeah, alignment continuing. Just wanted to show the 2024 plans. Last week I showed 2023, really focusing on 2024, and that's all of the plans in all of the states they're in. Berwick just talking about the new features on Medicare Center there, enhanced drug quoting, policy snapshot, MBI date validation, the Ask Integrity. Has anybody used that? I haven't. Would be interested to find out how and what it does really. I'm not sure the value on that, but if it's good value, then please use it and you know, give us some feedback. Personal URL, personal agent website, and the RTS attestation as well. Cigna Health Plan, don't forget, their PDPs are very competitive. We run some drugs for a client. I was helping one of our agents at a meeting and they had a drug plan, and Cigna is coming out pretty strong on a lot of these plans. So, you know, now it's commissionable. You guys should be contracted. If not, reach out to Lisa Perry and she'll get you contracted. And of course, a few other things with Cigna. They had a change in renewal payment. They're going to now pay per member per month for MA and MAPD plans. It was a lump sum and there was lots of chargebacks. So it's a bit like Blue Shield. They pay all their renewals lump sum. They're the only carrier that does. However, Cigna now is going to be paying monthly. That's basically what that is as well. Devoted Health, you're hearing a lot about them. They are moving closer to the West Coast, folks. So I know there's a rumor they're going to be out in Nevada very soon as of 2025. And I'm sure they're going to probably come across to California soon as well. So Devoted, very good company, very good engagement and communication with agents. We have that contract. And as you can see earlier, there's some 5-star plans out there. Molina as well, new HRA option is only available for Molina Medicare enrollments. They will only accept paper HRAs for 2024, just to let you know. And I think I mentioned this, Scan are going to pay $125 if you do 5 enrollments on Scan. For your AHIP, you get that reimbursed. And of course, United Healthcare do have their Medicare product portal, folks. It's a great feature in Jarvis where you can see multi-state, multi-carriers. It even lists all of your carrier partners in other counties and states and who to call. So everything's on there. That's it from me. Let's go through questions, see if there are any questions. Ventura Blue Shield termination. Do they have past December 7th to sign into another plan, Judy?
They do. They have an SEP technically until February the 28th. However, if they don't sign up into a plan during December for a January 1st effective date, they're not going to have medical or drug coverage if it goes on into January. So please encourage them to change now for January 1st.
Yep. Another question. Some clients are not able to complete the SOA via text. Any suggestions? Yep. Simplest suggestion out there. Do a verbal SOA. It's all on the Medicare Center. Everything is available. You can now do a verbal scope of appointment. Easiest way to do one. Everybody has a voice, so you're able to do a verbal scope of appointment. You don't need a smartphone to do it.
Great way to say that.
Is the Medicare app already updated with the new star ratings? I have no idea, Martha.
It is.
Okay, there we go, Judy.
It is, and the way that I know is I went into the star ratings yesterday, and it is showing Scan at a 3.5.
Okie doke. Thank you. And Mila just putting on their Cigna's 2.5-star PDP rating. Don't forget, on that, only 2% of people are going to be on a PDP with 4 stars or more. So 98% of people are going to be on low-rated star-rated PDPs. I think I said that wrong there. It's too early here, guys. But absolutely, there's a lot of stuff going on. Just explain that, you know, that's how it is. And a lot of these plans are, you know, have lower star rates. Okay, thank you so much. Have a wonderful weekend. We gave you 21 minutes back today. Go and enjoy your Friday. Have a great day out there. Don't forget, I love texts. If you're new and you do your first enrollment, text me. If it's your first enrollment in AEP, text me. I had somebody tell me already they've done over 30 enrollments. 30 enrollments for AEP yesterday. Can you believe that, Judy? So
That's amazing.
folks out there are having amazing time. Oh, and by the way, hot off the press, and I don't know if everybody got this, but I enrolled in the Plan Enroll agent online thingamajobby with, that's a technical term, with the Medicare Center. So if you do the Plan Enroll Network agent, that's the thing. So if you go training.planenroll.com, you can do your training. And guess what? I got a bunch of leads emailed to me saying, hey, as a Plan Enroll Network agent, we're giving out some leads. Here are some leads. So if you did that program, you might get some leads coming in. So that is a fantastic opportunity. Just wanted to say that.
Awesome. Neil, I had one more little update here from one of our experts on Cedars-Sinai. The Anthem Prime plan is not contracted with Cedars-Sinai. That's the Prime plan. It's not contracted with Cedars-Sinai.
Thanks, Judy. I meant to mention that, so thank you so much. So that Prime plan, and guess what? Anthem loaded up the Cedars doctors to say they were contracted. So that's why that was so important. But it's not. They got confused. How many times have we been talking Anthem and Cedars for years, Judy? Years, right?
Too many years. Yep.
Okay. And any other carriers have an SCP? That you know, Judy, out in California? Is it just United?
There's still United Scan, and Alignment.
There we go. Thank you so much. Okay,
Okay.
folks. Now I've only given you 19 minutes back, but have a wonderful weekend. We'll be recording this and putting it on the portal. Text good news. Let Judy know. I get lots of you reaching out. Love hearing it. And yeah, I'm in California for the next week or so. So I'll be out and about to see some of you folks as well. Appreciate your time. Have a wonderful, wonderful weekend and talk to you soon. Take care.